Male infertility has been increasing over the last 2 decades, and it has become a significant problem because male sperm count is declining, and the primary problems we see are in sperm movement and defective sperm production. There have been several causes which produce this, and some of the main ones are hormonal imbalances, which are presumed to be more in men who are working and who work in a stressful environment, which causes endocrine or hormonal imbalances, and also because of altered supply of blood to the testis. Both these phenomena cause a reduction in the number of moving sperm and defective sperm production, both of which lead to improper fertilization, wherein the sperm is either unable to enter the oocyte, or even if it enters the oocyte, it causes a defective embryo, and consequently that embryo is unlikely to survive and result in a healthy baby. The field of andrology, as we call it, which is the science of identifying what is the reason for men to failing to conceive or men who have erection difficulties, has been rapidly expanding and is now capable of making diagnosis as to why there is a problem, what do we do for this problem, how do we manage this problem, can we improve it, and what is the best method for this couple to conceive. And that whole armamentarium of diagnosis is called diagnostic andrology. Now, diagnostic andrology is rapidly evolving, just like I said, and the new tests which are coming out are specifically aimed at detecting what is a healthy sperm. And to identify a healthy sperm, people traditionally used to believe on the shape of the sperm and the movement of the sperm, which were rough predictors of fertility. Now we do believe that classically, like anything else, the internal genetic material, which we call as sperm chromatin, is the most crucial bit in the process of achieving a healthy baby. And this chromatin can now be easily tested as sperm is available in the ejaculate of the male, and we can test it to identify whether this chromatin is normal, and that is called the sperm DNA. So one of the tests which we commonly do in people who fail to conceive within a period of a year, or in couples who are presumably normal, everybody says they are normal but still fail to conceive, or in couples who have pregnancy losses which nobody can explain, we believe that it could be because of the sperm which has a defective or a damaged DNA. When we say damaged DNA, there is always a fear whether this damage does it mean it will cause an abnormal baby. Definitely, a sperm which is damaged causes a defective embryo because its capacity to produce a normal embryo is limited, but this embryo does not survive. It does not survive beyond a period of 4 to 8 to maximum 12 weeks, and the couple or the wife is likely to have a miscarriage or an abortion, as we call it. So it definitely does not cause a defective baby. That fear need not be there. More importantly, it is important to diagnose this problem because it could be in many cases managed, where we bring down the DNA fragmentation. In many cases, we are able to reverse and suggest them modalities which will help them to have a baby faster. And that is the advantage of doing a DNA fragmentation test or a DNA fragmentation index, as we call it. Thank you.